somebody once told me, sort of, don't imagine the most exciting thing as the decision-making factor when you're choosing what specialty to go into. Think about the average day. Think about the worst thing in a specialty. And if you're happy dealing with that, then the exciting stuff, will take care of itself.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. So the guest on today's show, we've been actually wanting to do this for years on end, as far as I can remember. And we've exchanged emails, we've exchanged direct messages on Twitter. I think it's a name that needs no introduction. A lot of us know him through his prolific YouTube channel. My guest on today's show is Dr. Rohin Francis. Dr. Francis is an interventional cardiologist in Essex in the UK, and a prolific YouTuber. So with that introduction, Rohin, thank you so much for doing this for us. And I'm excited and elated to have you on Parallax, and welcome on the show.
Oh, wow. What an intro. Well, thanks very much for inviting me.
Absolutely. So Rohin, we're going to get started by asking you, sort of your foray into medicine. And for those who are listening, if you do not follow Dr. Francis on Twitter, I encourage that you do. And once you follow him, I encourage that you read his pinned tweet. So I'm going to use that as a segue to answer this question for our listenership. The first question that I asked you, Rohin, because that is such a beautiful pinned tweet that you have, and it's lighthearted. It's also it's also very, very cute, for lack of a better word. But I'll have you answer that question for us, for the listenership.
Yeah, I mean, well, the tweet you're referring to there was my mum passed away a few years ago, and quite a while later, I was kind of clearing out a lot of stuff from the house, and found these old report cards from when I was about 7 or 8 years old, which, in light of discoveries I've made more recently, with better awareness of kind of neurodivergence and things like that, reading back my reports from when I was a kid, kind of entertaining. It's just, I was completely, the report is how disruptive I was, and I was naughty and couldn't concentrate, but clearly, was reasonably intelligent. So it was just a little Twitter kind of thread, sort of wondering how my mum kind of raised me, and my elder brother has been very instrumental in my journey into medicine. He's got severe learning disabilities. So how we both presented different challenges to her, and raising 2 boys on her own, I think would have been something I would have loved to have talked to her about. But yeah, I mean, that's kind of the background of my personality is a little ADHD and chaotic, but I think that's a personality trait that it's common to a lot of YouTubers. So I feel like I found my people when I started making content on YouTube, and it's actually kind of become almost like a second career now. I've been doing it seriously for 3.5, almost 4 years, and it's actually complemented my clinical life fairly well.
Yeah, no, excellent answer. Very insightful. And, before I, dissect and sort of parse through your journey into being a serious YouTuber, what I want to ask you is, as you were growing up with your mom and your elder brother, and, thank you for sharing, those personal details with us. At what point in time were you convinced that you wanted a career in STEM, science, tech, and engineering and math? Did I get that right?
Well, there are different versions. There's STEM and STEAM, and STEM with 2 M's, because medicine is, in the original STEM, medicine's not actually there. It's maths, as you said. So, but yes, science in general, very early on. I was a very sciencey kid. I really excelled at science, and I actually, enjoyed lots of subjects, but that definitely was my area. But medicine, in my head, I remember it that I pretty much last minute made the decision to apply to medical school because my best friend was, and I didn't know what to do. And I was sitting next to him, and I said, "Oh, yeah, okay, I'll do medical school as well." I think in reality, I probably gave it more forethought than that. But unusually for an Indian household, my mum was very keen for me not to do medicine and really tried to put me off because I think she had seen her sister work really, really hard and felt that it was a hard life to go into. And so it was kind of unusual. It was the reverse of the usual stereotype. But however I made the decision, I think it definitely made a lot of sense because I liked that scientific stuff, but I was also, quite fond of people and had lots of other interests. So I think medicine offers that balance of lots of different disciplines and lots of different skills. I think it's a really good choice.
Yeah, so that's good to know. I think for a lot of us, the seeds for medicine or science, so as you said, are sown very early on. Perhaps in middle school or for some of us in high school, and then it's interesting you bring up your mother's rather lack of interest to put you into medicine, because for a lot of the guests who've been on the show and also friends and family members who I'm obviously talking about my perspective here, but who are in medicine or have a career in medicine, it was a lot of positive reinforcement from their own households. So it's kind of interesting that you were sort of going upstream, not sort of downstream.
Well, yeah, I mean, the irony is I was being rebellious and ended up doing the most cliched Indian thing imaginable. So things tend to work out in a funny way.
Yeah, no, that's actually a quotable quote. The most cliched Indian thing possible, which is become a doctor and get into.
And a cardiologist. From what I understand about demographics in America, there's quite a lot of Indians in cardiology. I understand.
Absolutely. I mean, I think if a brown man from a country called India lands on the East Coast or the West Coast and somehow belongs to a career in medicine, then the saying is that, oh, it's another brown Indian kid who wants to be a cardiologist, and that.
Why do you think that is? I've never actually got an answer.
I think this is a question I actually asked Ajay, Dr. Kirtane, when he was on the show. I believe this was season 1, and he, I think he was honest about the answer, and I think it definitely is a branch. No question. It's very. I mean, there are other fields, also within medicine that pay you well, but I think with cardiology there is a certain glamour,
sure,
for lack of a better word, associated with it. There's that social fabric and status, and also back in also like the burden and the scourge of disease back home is immense.
Sure.
And I think when you become a cardiologist and more, I mean, there's also you can go on to extrapolate that why that brown kid would then land up in interventional cardiology, not only in cardiology. It's again, there's that certain reverence that the public associate oneself with if you end up saving the life of a loved one, whether it's in the more likely than not back home in the throes of a heart attack, that you certainly gain that reverence and that stature in society. And I think that is very infectious for kids when they see their either their relatives or their parents in that role. It's sort of it's very infectious. It sort of attracts you. So I think that's how he answered it. I thought it was a very honest answer, and also it pays you well. So there's the social status, there's the glamour, and then there's the economic value. I think which is a difficult combination to sort of compete with. So I think that's why a lot of us tend to gravitate toward cardiology, and even within cardiology, procedural cardiology. Which actually brings me to my next question: is at what point was cardiology the answer for you? I mean, was it in medical school? Was it in residency? When was it?
The answer was the heart, probably fourth year medical school. I did a cardiology placement, which I absolutely loved, and I had some fantastic teachers, real kind of old school consultants who spent, an hour just talking to me about the JVP and things like that. So really had a fantastic introduction, but you'd kind of already hinted at it. I was very keen on doing things with my hands. So I just kind of assumed that surgery would be the route I'd go down. And I thought I was going to be a cardiac surgeon and sort of started down that path. And then a couple of years out of medical school, decided to switch to cardiology. Well, maybe not a couple of years, within the first year. So I kind of did a little bit of surgery, but didn't get too far down that line. And actually, the main reason I switched was getting to know cardiac surgeons, which sounds awful. Nothing against them, but seeing the lifestyle they had, particularly the trainees who are closer to my level, they just really were being flogged, really working like crazy. And of course, cardiology is not a walk in the park, but it felt like it was less toxic. Like cardiac surgery still had a lot of, very old-fashioned hierarchical kind of bullying that I saw, and I just didn't feel that the I guess they would have been the equivalent of residents and fellows. One of them had been fully qualified as a consultant level, so as an attending, but had been waiting on a job for years. And I just thought this is a very tough line to choose. And so I switched. And obviously then if you come from a surgical background, interventional cardiology is the most logical. And it was just a perfect fit. And I was really pleased to be able to maintain the kind of general medical, internal medicine kind of knowledge and thought processes that go into being a physician. So I couldn't have no complaints at all. I definitely landed up in the right field.
Yeah, it's interesting you bring up cardiac surgery and fourth year of medical school, because that's where I pivoted as well. The podcast which was aired just previous to this one for the listenership, and I think this was a guest episode where I actually was being interviewed by a medical student from Neomed, and he asked me this question as to when was it that it was cardiology for you. I answered exactly the way you did. It was cardiac surgery for me. And, for me, the reason to sway away from surgery was, although, I mean, like yourself, I still love doing things with my hands. That's sort of like, it gives you the feeling that you have actually quote unquote done something, for the patient that you're taking care of. I think more importantly for me, I found that I was lacking the excitement of again, nothing against our surgeons or surgical colleagues. Like you said, it's a skillful field. It requires a lot of hours. It requires a ton amount of skill and experience. For me, it just felt that I was lacking the cognitive excitement behind what I was experiencing when I was in internal medicine wards, and coming up with a diagnosis, solving that puzzle, going with the algorithms, So I thought, okay, well, if I enjoy the algorithms and the problem solving and the decision making and arriving upon a diagnosis, and then if I do also want to do things with my own hands, and like yourself, for me, heart was always where I gravitated toward. Even in medical school, then I said, I think interventional cardiology is it for me. So it's pretty interesting how in sync our thought processes were at that stages of our lives. It's fascinating to me, but thank you for sharing that with me.
Yeah, I do. I was very lucky to do 6 months with the transplant team. Once I'd already become a cardiology trainee, but there was a kind of very nice working pattern. So we kind of cross-covered the surgeons and worked together quite closely. And so this was now several years on from me being in theatre. And then I got to scrub in with the heart transplants, which I never had done before. And I did have that pang of like, oh, did I make the right decision? Like, this is so cool. And really, I thought that was just one of the most amazing experiences to witness all that taking place. But then you have to remind yourself, well, if you want to be a transplant surgeon, then you're, limiting yourself to, in the UK, just 5 or 6 centres, and you've got to basically wait until somebody retires. So I keep having to remind myself of these other factors. And I think that's a useful point for junior doctors, because somebody once told me, sort of, don't imagine the most exciting thing as the decision-making factor when you're choosing what specialty to go into. Think about the average day. Think about the worst thing in a specialty. And if you're happy dealing with that, and, whatever you feel that is, and whether that's a sort of patient with limited treatment options or something like that, if you're happy dealing with all those humdrum kind of everyday things, then the exciting stuff, will take care of itself. So I think that was useful advice, that yes, there is some amazing experiences in any field, but they're few and far between. And most fields of medicine get pretty routine. That's just natural. And that was another reason why the other thing that I was considering very seriously was intensive care. And I really still enjoy it a lot, but I felt like, a lot of the patients started to feel a bit similar, and I felt like maybe it would not be quite as exciting after 5-10 years. But for me.
Yeah, no, great, insights into, crucial, pivotal decisions on how to decide upon which paths to take in your career, and, where your passion is. And that's actually a great advice. I never thought of it that way, but I think for those of you who are listening, if you can deal with the worst day or an average day, then the exciting part of that specialty or that subspecialty is going to take care of itself. I think that's a great tip. So thank you for sharing that with us. Now, what is it? So first off, when was it that you stumbled upon, for lack of a better word, into foraying into YouTube? Was it during your training as a cardiologist, or, I mean, what I'm getting at is, what was the motivation to upload like your first video on YouTube or your first content on YouTube? What led to that in your life that you decided, what, I'm just going to upload this on YouTube?
Yeah, I mean, I can remember it very clearly, because I've always kind of I've done a little stand-up comedy, not a lot, but I've always enjoyed kind of telling jokes and stuff. And even when I would do presentations in a kind of serious setting, I'd still make it quite lighthearted. And so I've always enjoyed giving kind of geeky humor talks. And then one of my friends, who himself is a scientist and is involved in sort of science communication, which is the term that's been given to all the careers that encompass communicating science to whether that's to the public or other scientists or whatever. And he's quite active in this field. And he said, why don't you just film yourself doing one of these talks and put it on YouTube? And so I didn't quite do that. I made a dedicated YouTube video, but the idea was, I didn't have to think of at all, because I'd had this in mind for ages, this really cool idea that I would, bore people at parties. Probably I thought I was being very sparkling and interesting, but they probably got bored. But I had this, it was about Leonardo da Vinci and the heart, and how da Vinci had studied the flow of water and had come up with this idea that the same vortices which form as water goes through a narrow space also form coming through the aortic valve, and that's why you have the sinus of Valsalva, to allow these vortices to form and to actually actively shut the valve, preventing any aortic regurgitation. And I'd read this a few years ago, and I just, it really blew my mind. But it's quite a niche kind of, you've got to be quite interested in some niche areas to find that interesting. And I just thought, I'm going to make a video on this. So I made it quite short and sweet, and it found an audience. So it was just immediate. That's the wonderful thing about a lot of creating content on social media is you can get immediate feedback. And it's not the same for all media, actually. One of my friends is a fellow podcaster like you, and contrasted that sometimes with a podcast, you don't get that immediate feedback. But YouTube, Twitter, where instantly people can comment and say this is terrible or whatever, it becomes a bit of a, it's a bit of a drug, and you kind of, that incentivizes you to do more. But the background to all of this was that I used to think that I would have a bit of a career in sort of medical journalism. So years ago, I was quite a active writer, and I sort of wrote in my student paper and edited that and everything, and was quite serious about it and wrote for various different publications, but then just kind of let it all fall by the wayside during my training, which is fair enough. I was concentrating on being a junior doctor, but I've always had that desire to, I guess, tell a story. And so that was the background to all of this. And I've just, I've got no shortage of topics to cover, because I think there are so many interesting things to talk about, whether it's policy, whether it's science, whether it's medical history. So that's the great thing about running your own channel or social media account, is you can just talk about whatever you want.
Yeah, which brings me to the next question, and that is, for those of us who have like active social media accounts and following upwards of 10,000 followers on, for example, Twitter, and I'm sure, you have a huge following on YouTube. And before I get into more of like the nuts and bolts of content development and how do you keep up with it, and what is your underlying motivation to keep uploading and keep going. Before I get there, I do wanted to ask you this question, and that is, are you conscientious of the kind of tweets you're tweeting, or the kind of content you're putting out there? And what I mean by that is, do you let your complete personality to show on social media, versus being very selective on, no, I want to portray myself as X, Y, and Z, and I'm only going to let that facet of my personality shine on these social media accounts? And the reason I ask is, more sort of like an introspective question for myself, because, I am myself on social media, like 100%. Like I have a facet to me which is very artistic. So I would, tweet like poetry, and I would tweet, like philosophical thoughts, but I also obviously am a clinician researcher or a clinician scientist, and whenever there is a paper that I've published or original research, I will be very, very methodical and very scientific in portraying that and putting that out there, whether it's on Twitter or LinkedIn. And I've questioned. Not that I've questioned. I think I'm fairly fine. I personally am fairly fine with both facets of mine. I think that's who I am, and that's what I'm portraying, very honestly. But I've wondered if people would think otherwise, as if, here's this person who is writing about, is romanticizing poetry and is writing these deep philosophical poetic verses, and has published a book of poetry, but then he's also publishing these papers on cardiology and in all these journals. And what do you as someone who would be receiving these on the other end, you think people would embrace both facets? Or is that something that you've consciously thought about, like, no, I'm a cardiologist and I'm only going to let that facet of mine shine on social media?
Oh no, for sure. I understand if some people approach social media in that way, and there are lots of our mutual friends whose accounts are unfailingly professional and, purely, cardiology, kind of almost more like a LinkedIn kind of personality. And I understand why. And sometimes there have been anecdotes where there have been, problems and they've had their fingers burnt, and so that's fine. But for me, I feel like you really get the most out of social media, and believe me, I'm as positive as negative about social media. I think there are pros and cons, but I certainly, for me, it's been a definite net positive. I think you get the most out of it if you are yourself, and absolutely, I think who you see online or who you get online is I'm mangling the idiom here, but what you see is what you get with regard to my personality online. And I think the whole success of the channel has been because I have put a bit of personality into it, because the information I'm giving, I'm sure you can find in other places. I do try to be a bit different with the topics I cover. I don't just do sort of basic explainers. I try and take interesting angles on things. But, I've had videos where I've dressed up in like period costume to pretend to be sort of William Harvey talking about the cardiovascular system in the 16th century or 17th century. And, done all kind of silly things like that. And it's fun. And I do think in the back of my mind, if a patient saw this, would they be shocked? Would they be, like disappointed or anything? I don't think anything that I do would, they would see that we're human beings too. The interesting aspect to all of this, I think, and has become more apparent in the pandemic, is sometimes I am a bit alarmed by people's personalities online, because they'll really lose their temper and start arguing with colleagues in really quite unpleasant ways. And I'm just a bit surprised that they're doing all this publicly, and this can be seen. And we all know stories of people who have come unstuck and said something a bit unsavory online. And I think tempers get very heated. So, you are sort of querying if somebody saw you posting poetry, would they feel that you're not a serious doctor? I think that's unlikely. I think people can appreciate everybody has different interests. But I think if you're tweeting really kind of very, I wouldn't say extreme, because extreme suggests maybe something a bit different. But if you're posting quite derogatory terms about a different group, so obviously what I'm getting at here is a lot of political kind of related stuff, and people are saying quite disinhibited things online, and I'm a bit surprised. So I think, of course, be yourself, but I always do think potential patients, and this was brought home to me quite recently, because a patient told me he'd been looking me up online just last week. So people do it, they will check you up, they will see what you're like. Why not? I mean, if someone's going to do some high risk procedure on me, I want to know a bit about them, and you've got to be prepared for the things that you put online to be visible. I think a patient might think I'm a bit of a joker, but I think most people wouldn't see that as a bad problem, as a bad aspect of being a doctor. In fact, humor is very central, I think, to my practice. I use that a lot. Some doctors are maybe a bit more empathetic, and I think my strength is maybe cracking a joke or two. It's not always appropriate. I don't break bad news with a joke, but a lot of the time it creates rapport. So I don't ever feel worried about what I put online. And obviously, the golden rule is you just leave the patients out of it. If you find yourself tweeting details about a patient history, or sharing identifiable information, then that's the line in the sand you must not cross. And as long as you don't do that, then I think I wouldn't worry about it too much. I think some people can really be very cautious about everything they put online, but I think you're missing out then, because the whole point of things like Twitter, I mean, you mentioned Twitter, who knows if Twitter's even going to survive much longer at the moment, with Elon Musk demonstrating that expertise doesn't cross all fields. But yes, the great strength of Twitter has been that we can just get to know people like yourself, and all these contacts I've made through Twitter. So I think it's most valuable when you're yourself.
Yeah, no, I couldn't agree with you more. And that's been sort of my mantra on social media, is that I'm just going to be my most authentic self, and be willing to share all facets of mine, as long as And there's a checklist that I follow, and I think what I follow is it, well, first off, is it necessary, and if it is, then the second thing is it true, at least to me, and then if those two are checked, then the third one is it kind, and I've never faltered in any of my posts as long as I've been able to. It's a sort of a mental checklist, right? Is it necessary? Is it true? Is it kind?
Yeah, I think that's a great sort of 3 steps to ask yourself. I think I would adhere to the first 2. The last one, I guess maybe I've developed a bit of a reputation for trying to take on people peddling misinformation or giving bad information online. So sometimes I can be a little bit critical, but that probably doesn't fall into the kind category. But I think it's justified in that case. But yes, otherwise, for sure, it's become a bit of a cliche that the younger doctors kind of make fun of the hashtag be kind because it's such a kind of banal thing. But I think it is good advice. Don't go out to be mean to anyone.
Yeah, which is like the final 10 minutes of the segment here. So maybe talk to us about, sort of the nuts and bolts of being an active YouTuber, and, are there specific days in the week where you have, sanctioned a few hours where you've told yourself and you've set your...
I wish. I'm not that organized. No, it's totally ad hoc. Like, it's completely just whenever I get a free moment. And this year, so I made the step up to being a consultant just within the last sort of 18 months or so. And that has brought more predictable hours. As a fellow, you're doing lots more nights and everything. But obviously, it's a very different workload. There's way more admin workload now. And so I've found that maybe this year I've had a bit less energy to do YouTube. And it's very much something where, you have to kind of psych yourself up. I've got 2 young kids as well. So that's another thing that I want to spend as much time as I can with them. And, once I've put them to bed and I've had a long day at work, often it is hard to find the motivation. But I think the trick is, people often ask me how I sort of fit things in. The trick is just trying to compartmentalize little bits of it. So the bit I find most enjoyable is the writing. And I really enjoy just diving into a topic, researching it. And that might take me a month, of just sort of reading, making notes, just every now and again. And if you enjoy it, if you're interested in the topic, then that's really not work. That just feels like you're just, satisfying your curiosity. And I think a lot of people are like that. I think loads of us just have curiosity, read different books, and I've got a pile of unread books like I think everybody does, and just sort of slowly work my way through them. And it's not that much of a bigger step if you're already doing that, if you're already sort of spending your time finding out interesting stuff, to just kind of jot down some key points. And the beauty of YouTube is it's not a PhD dissertation or thesis. It's you don't have to be super in depth. It is about summarizing the key points. And so that's the fun bit. I'll write a script. Then I will maybe think about how I want to frame it, sort of, what kind of style of video, put some jokes in. The bit that I hate, which is kind of odd and people find surprising as someone who makes YouTube videos, is filming. It's such a faff to set up the camera and the lights, and I don't know, my friends like sort of make fun of the fact that I literally don't do anything. Everybody else puts a bit of makeup on, and I'm like, no, I just get in front of the camera. I don't even comb my hair sometimes. I'm always in various different states of unshavenness, and I just get the filming done and then edit. And I have recently started getting some help with editing, and for the last 3 or 4 videos. But until then, I'm just doing all the editing myself. And again, that's something that I quite enjoyed learning, just learning the software and getting to know how to edit a video. So it's a very slow process. And I think if I listen to, see, most of my friends who are in YouTube are full time, and so they see it as a business, that it is their whole livelihood, and they just like, what are you doing? I mean, for God's sake, outsource these jobs. Why are you still doing everything? But I like it. It's kind of like a hobby. So it's not the most efficient, and I'm very slow. And at the moment, I'm posting one video maybe every 2 or 3 months. But I definitely want to keep it going. And I think, you were sort of asking more kind of generic questions about YouTube in general. And for anyone listening who, I'm sure a lot of your listeners are medical students and junior doctors. And certainly, here I encounter a lot of young doctors and students who, they're digital natives, right? That's the term. They've grown up with this. When I was at medical school, YouTube didn't even exist. And then, so having a YouTube channel or something like that is really common now. But I feel like you've got to sort of develop your voice. What are you trying to say? Are you just going to be exactly the same as all the other channels, or what are you going to say that's a bit different? What do you find really interesting? What's your passion? And just go for that. Don't try and appeal to everybody. That's not the point. Just do whatever's interesting for you, and you can find your niche on YouTube. And I do feel like it is a cut above a lot of the other social media platforms, because you can really go in depth, and I was just saying that it's all about sort of summarizing a topic, but a lot of YouTube videos are super in depth. 1 hour, 2 hour, 3 hour videos are really popular. So whatever your interest, whatever your audience, you will find it. And I would definitely recommend people having a go. The one piece of advice, I mean, there's lots of advice, but the one thing I'd say, particularly for some of the younger people getting into social media, is just be, obviously all the medical advice we've given about patient confidentiality and things like that, but in terms of yourself, is I think a lot of people overshare, and they make their personal lives very much the product. And I don't think you should be the product, or at least think very carefully before doing that. If you want to become a vlogger sharing your life, then I think that, that has ramifications that you might not be aware of early on. And I think you just be cautious about how much of your own life you share online, because people can develop quite strong parasocial relationships, which is, they feel like they know you, even though, they've never met you. And I think that has some pitfalls. So I think, by all means, generate content, make YouTube videos, experiment, do fun things, but just maintain your own life away from the screen. And I've always, I for a start, I was significantly older than most YouTubers when I started, but I'm very pleased that I've never kind of made it about me. It's just about medicine and science, and I'm the presenter kind of thing, as opposed to being the product.
Yeah, no, that's actually very good advice. I don't think I've quite thought about it, but I do think it's important to sort of have your own sacred space where, it's only you and your loved ones, and there's no one else. Like there's that invisible fence. And that sacred space should only be, yours. And I couldn't agree more that a lot of these things can percolate into your personal life, particularly for, a YouTuber like yourself, which has, you do have screen time quite a bit. So, people start to relate to you and think that they know you really well in person as well. So, no, thank you for bringing that up. I actually never quite thought about it that way, but it actually makes a lot of sense. It makes complete sense. So, congratulations for everything that you've done. I mean, you've got a fantastic YouTube channel, and for those, and YouTube now has a handle too, right? Like other social media accounts, is there a handle you want to, for those, I'm sure, most of the vast majority of listenership already has subscribed to your channel, but for those who haven't, is there a handle you want to share while you are on Parallax? And then I'll ask you, some final remarks about Parallax and about podcasting in general before we close the show.
I'm Medlife Crisis everywhere, so you can find me on whatever platform. I'm not really active on most of them except YouTube and Twitter, but I'm Medlife Crisis.
Okay, awesome. So Medlife Crisis is how you can find Dr. Rohin Francis. Excellent content. I encourage all of you to follow him. And Rohin, final closing remarks. Well, first of all, I'm flattered that you are a listener of Parallax, so thank you for that.
Sure, of course. You've had quite a few of my friends on, so it's always nice to listen to them.
Yeah, no, thank you. So your remarks on what you think Parallax is and how we've come along through all these years. I mean, this is season 4, and come 2023, it'll be season 5. I think it'll be good to hear from another creative cardiologist who knows what it takes to create and share and be vulnerable. So I'd like to hear your comments on that, and then any closing remarks you have for the listenership.
Yeah, sure. I mean, that's an interesting question. Sort of, I haven't critically appraised, but certainly, I've been listening from right at the beginning, because I remember you saying when you started it, and it's great. I think all of these things, the way I think about my channel is probably the same way you think about the podcast. It's just a thing that you have made. It's your creation. You've put yourself into it. So in many ways, if people are listening or watching, that's great. And obviously, it's always nice to create something that other people are going to consume. But I'm sure that the satisfaction of making something that is your own is kind of the main motivator. And I'm sure you have developed a lot of skills through doing this. I've always sort of had the idea of maybe doing a podcast, but I haven't tried. Just it's too much to take on with everything else. I'm an active sort of listener of quite a few, and I think it's quite unique in that it's a way to get a more in-depth conversation. And so, I mentioned a few friends, but also obviously a lot of people I didn't know that I've heard. So the ones I'd probably get most value from as a clinician is sort of going over some of the trial summaries you've done with Suffolk or Purvi, and then maybe diving into a particular topic with an expert. But there have been quite a few just exploring the different facets of different doctors, and I think that can only be a good thing. Sort of bringing people to life as three-dimensional individuals, and I'm sure people get a lot of benefit from that, particularly those sort of looking to get into the field.
Yeah, no, thank you for sharing that. That certainly means a lot to me, and I'm sure the people that you mentioned Suk. I'm actually going to write to him shortly, because it's come.
It's that time again.
It's that time of the year again where we have to summarize everything cardiology in 2022. But no, thank you so much, Rohin, for being here and for sharing your journey into being a cardiologist and being a YouTuber. And from all of us at Parallax, we wish you the very best. From anyone everyone who's listened and who keeps listening, thank you so much. It means the world to us that you listen. We are very receptive to your feedback, and we actively incorporate your feedback into content development. So if you have anyone who you think we should feature, please write to us, and we'll be more than happy to bring that cardiologist on board. Again, rate us and review us on various social media platforms, whether it's Apple Podcasts, SoundCloud, or Spotify. And we'll be back again one of these Mondays with another guest. So thank you for listening. And thanks again, Rohin.
Thanks so much for inviting me on, Ankur.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.